everybody, and welcome to the October 2nd, 2017 Children's Levy Allocation Committee meeting. I'm City Commissioner and Allocation Chair Dan Saltzman. And with us today are my fellow committee members. On my right is Julie S. Young, who is the city-appointed member. And on my left here is Mitch Horniker, who represents the Portland Business Alliance. Serena Stoudemire-Wesley and County Chair Deborah Kafori are unable to make today's meeting. Our staff is Lisa Pellegrino, Meg McElroy, Lisa Hansel, Mary Gay Broderick, and John Kelly. And before we go too much farther, let's ask for approval for our meeting minutes from July 2nd, or July 24th. Excuse me, July 24th.
So moved.
Second? Okay, it's been moved and seconded. All in favor, say aye. Aye?
Aye.
Okay, great. Minutes are adopted. And now we have time for public comment on items that are not on our agenda. So if there's anything that's really got you perturbed, or you want to talk to us about something else that's not on the agenda, this is your time. So is there anybody here that wishes to speak to us on non-agenda items? Okay, seeing none, we will move on. We'll begin by hearing from staff who will walk us through the possible funding scenarios, including funding child care subsidies for working families and/or expanding Head Start services. We'll discuss those options, and then we'll open the floor to public comment before we make our final decision. So I'm going to turn it over to Meg McElroy, it looks like.
All right, thanks. Good afternoon, everybody. Before I walk you through the investment options for our accrued revenue, I just want to say up front that the options require me to explain a lot of information that could be kind of dense for some folks, but I'm going to try to walk us all through it as succinctly and clearly as possible. So feel free to interrupt with any questions as I go, if that sounds good to you. So you might recall that last summer staff alerted this committee that there were $10.3 million in accrued revenue from the past couple of years when actual revenues exceeded projections. Over the course of the last year, with staff support, you invested all but $1.6 million of that accrued revenue. And at the last meeting on July 24th, staff introduced to you the options that I'm going to review today. And you at that time elected not to make any decisions because you wanted just a little bit more information on understanding the state funding cut impacts on the options. So we have a little bit more information. So for that $1.6 million that you have to allocate for use over the next 22 months that remain in the current levy, these are the three options that we have put together for you. And so I'm going to start with what I'm calling option A, which is to invest that in expanding the levy's community child care initiative, which would help offset the state budget cuts for the employment-related daycare program. There are sort of two pieces to this option. One addresses child care affordability and the other addresses child care quality. So I'll explain the child care affordability component and then the quality component. A little bit of background. Many of the early childhood and child abuse prevention intervention services that are funded by the state in our community and that are in part supported by the levy were spared significant cuts from state budget cuts for the next biennium. However, that was not true for the employment-related daycare program, which supports many of the families that our services support as well. Those services were cut $11 million statewide over this biennium. And there were a couple of other things that experienced moderate cuts, including the early learning hubs across the state and the state's child care quality improvement efforts focused on in-home child care providers. So this option A is in part to help address those budget shortages for the next 2 years that the state has implemented as a result of legislative decisions. So for the child care affordability piece, option A includes investing up to $1.2 million in child care affordability for the remainder of the existing levy. There are currently about 8,000 families, over 8,000 families across the state involved in the employment-related daycare program receiving state child care subsidies. They will not be cut off from that program. However, the state is planning that the natural attrition of families out of that program will reduce the caseloads by over 650 families within the next 2 years, and they will begin a wait list for families who might want those benefits beginning this fall. There are an estimated 2,000 families on that benefit. I'm going to start calling it ERDC since I've said what the program is, here in Multnomah County. Portland Children's Levy currently funds the Community Child Care Initiative that's administered at Child Care Resource and Referral of Multnomah County to provide additional help to families who are on ERDC. ERDC provides some support to working families. However, they are expected to contribute a substantial part toward their child care costs, which can often preclude them from even opting to participate in the subsidy program to begin with. Our program is designed to help families pay no more than 10% of their income toward their child care costs for any family that is earning 185% of the federal poverty level or less. We also, through the Community Child Care Initiative, support families earning between 186 and 200% of the federal poverty level to pay no more than 15% of their income toward child care. Families in that income bracket are not eligible for the state's ERDC program. So the Children's Levy provides a critical piece of support to families at a time when they are very vulnerable to not being able to maintain employment because of the financial difficulties of affording quality child care in our community. ERDC and the Community Child Care Initiative, which I'll begin calling CCI, supports families with children who ages infant through age 12 with before and after care, so it's not exclusively supporting children in early years. And our CCI program requires that families use child care providers who are participating in the state's quality improvement program called SPARK. So we are seeking to support low-income families, working families, to access the highest quality child care that we can offer. As ERDC constricts over the coming biennium, it will limit families' access to CCI as well, because we have created the program such that it is requiring that families who want CCI first apply for and get the ERDC benefit, so we can be sure that state resources for eligible families are coming to our community to help them. CCI is funded currently by the levy to serve 100 children a year, and last year it exceeded its goals, serving 134 children. The median benefit to families currently is about $300, a median monthly benefit, $300. ERDC payment, median monthly payment is $600, and the median monthly cost of childcare for families who have been involved with the CCI is about $1,100 a month. So with our funding, this one, under this option, we could invest, the levy could invest additional money toward the Community Child Care Initiative to help families who are cut off from accessing ERDC and would otherwise be on the ERDC wait list. The cost implications of that are important to understand is that if there's no ERDC benefit coming to a family who's on the ERDC wait list, then the Child Care Initiative would be paying more per family than it would to a family who's both receiving ERDC and CCI. So we could, with this 1.2 million of the 1.6, probably support another 80 to 100 children annually who would otherwise not access ERDC in the next few years due to the wait list. In addition, one small piece of the consideration is that the way that our CCI currently operates administratively is that the use of staff at Child Care Resource and Referral to screen families for eligibility for CCI depends on the ERDC eligibility and screening that the state is doing with families. So if we are to consider funding and supporting CCI to help families who would otherwise be on the ERDC wait list, we just need a small additional amount of FTE at Child Care Resource and Referral to handle doing a little bit more eligibility screening, because they wouldn't be having the advantage of the state doing a part of that screening first. and it would only be about 0.5 FTE more. So that's the affordability piece of option A. The quality piece of option A is to invest $320,000 over the remaining time of the levy in supporting focused childcare networks. I will explain what those are specifically in a minute, but just to say there's sort of two pieces to that $320,000. One is to help with funding cuts that would go into effect next year with 4 networks that are currently under operations. And the other piece is to start a new focused childcare network with Somali providers. So the state funding cuts for the focused childcare networks in our community would affect loss of 2 out of 4 culturally specific childcare networks next year. Currently, through state funding, Early Learning Multnomah provides support for 4 focused childcare networks, one that benefits Latino childcare providers, 2 networks that benefit Russian childcare providers, and one that benefits African American childcare providers. Networks are a 2-year cohort of about 12 to 15 in-home family childcare providers that are culturally specific and receiving support from a culturally specific network coordinator who provides coaching around the state's quality childcare initiative, the SPARK program. So the network coordinators assist family childcare providers in creating their portfolios that describe how they are addressing those state standards, completing hours of trainings that are required for them to receive ratings in that program, and assuring that they're progressing over the 2 years in that quality rating system. By way of information, last year the networks served 52 culturally specific in-home childcare providers. 14 of them now have star ratings, and nearly all of them have submitted their portfolios for review by the entity that does that work. And they've all substantially increased the hours of training that they've completed toward achieving a rating. Child Care Resource and Referral is interested in starting a new network to support Somali child care providers. Interest in this network arose out of Somali child care providers seeking out training and support from Child Care Resource and Referral locally, but the Child Care Resource and Referral not feeling that they have the adequate support and staffing, especially language capacity, to support those providers the way they've supported providers in the other 4 networks. Child Care Resource and Referral is working with community partners to develop what this model would look like, and they've also looked at a very well-done model that grew out of the Somali community in Seattle on how to develop this network. Health Share of Oregon, which is our coordinated care organization locally in Multnomah, Clackamas, and Washington counties, and the Oregon Community Foundation are also quite interested in the child care focused networks and are in talks about how to support providing additional funding toward achieving specific health objectives for children and providers in those networks. There's no clear plans yet, but there are potential other funds that could be made available to do other work through the networks as a sort of evolving system. There are no state funds to support any new networks. As I said, the only state funding that's going into these services right now is slated for some reduction in the coming year. So the option A that I'm putting here, or that we're explaining here, includes $320,000 to fund 2 networks next year that would otherwise be cut, each at $80,000 a year, and then starting the Somali network and funding it for approximately 2 years. So at $80,000 a year, that's $160,000 for the Somali network, and then $80,000 for each of the other networks that would otherwise be cut. So that's option A, affordability and quality. Should I go into option B, or do you want to ask me questions about that?
Any questions?
I had one question about 0.5 FTE of support. Do you have a sense for what the actual dollar amount would be?
It depends on who they hired to do the job. There's only 1.5 FTE right now in that program. 0.5 handles the sort of financial side of getting the reimbursements to the providers for serving the children who are involved in the Community Child Care Initiative, and the one FTE handles all of the outreach and enrollment, both to providers and families for getting them involved in the program. So the R&R indicated that 0.5 more would be what they would need to kind of add the additional capacity.
Okay. Okay. But in terms of what that would look like for
Like an
levy
hourly
dollars,
rate,
is it?
the
is it-
staffing?
Right.
Off
Any
the top
idea?
of my head, I don't know what they're currently paying the two positions that I mentioned, but I can go back and look at that in our records.
And that would be an ongoing, that would be a commitment for that 0.5 FTE for the 2 years that we're
For the
providing
additional
this.
funding,
Right.
yeah.
Okay, okay. Thank you.
Yep.
And I just want to make sure I heard you right. When you were talking about the employment-related daycare, did you say the average family expenditure or cost is $1,100 a month? And the
The-
ERDC provides a $600 benefit? Did I hear that right? Or-
You did hear that correctly.
Okay.
Just to put full explanation on it, those data come from the families who are enrolled in our community child care initiative. So because of our funding to CCR&R for that initiative, there are data I can ask them for that I might not be able to get otherwise. And one of the pieces I ask them for is, what is the monthly median cost of childcare for the families who are participating in this? What's the monthly median ERDC benefit that they're receiving? And what's the monthly median CCI payment that we're paying? So that's what those figures are. If we were talking about all ERDC recipients in Multnomah County, I don't know what those monthly median figures are.
Okay,
Is that the distinction there, Claire?
okay, thanks. Okay, why don't you go on to option B?
Okay. Option B is investing $1.6 million to expand center-based early Head Start services. So when you all made some decisions in the spring of 2015 with some, again, at that point in time, some higher revenue realized than had been projected, the decisions you made at that time included an investment of $1.25 million to expand Head Start services in 6 classrooms for 120 children per year. Head Start, remember, serves 3 to 5-year-olds, and what I'm about to explain is early Head Start, which benefits infants and toddlers. So because at that time you invested additional dollars in Head Start services, you did not invest in expanding early Head Start. Early Head Start services provide what is essentially full-day childcare to families experiencing poverty. And so it is for our youngest children in Portland. There are 2 main providers of those services in Portland, Albina Early Head Start and Mount Hood Community College Head Start, and they each have geographic areas that they're contractually obligated to serve with those federal Early Head Start funds. Albina serves North, Northeast, and Inner Southeast Portland, and Mount Hood Community College serves East Portland and East Multnomah County. Both of those agencies are current grantees of home-based early Head Start services as well as Head Start preschool services. Across Multnomah County, there are only about 300 slots of center-based early Head Start care. So there are thousands of infants and children in our community living in poverty, and we have only a tiny fraction of the types of services that could benefit them when it comes to early Head Start. A couple of sort of considerations with this option. This school year has begun, and center-based Head Start and early Head Start services typically run in conjunction with the school year. So you'd be considering starting up a center-based classroom sort of looking service after the school year has begun. So we'd probably be looking at having something open as of January. An additional consideration for you all is that as it stands, the levy has allocated a substantial amount of money in its early childhood portfolio, which I think is very good. However, there are many other important needs in our community, and investing more funding toward early childhood at this juncture could cause pressure to maintain later investments should the levy be renewed. So a consideration for you. A typical early Head Start center-based classroom serves 8 children a year due to childcare licensing requirements and early Head Start performance standards, and costs typically within a range of $160,000 to $180,000 a year. So with this option, if you were to invest all $1.6 million in it, you could fund up to 6 classrooms for the next year and a half or so for the remainder of the levy. Questions on option B before I get to option C?
Do we know if we were to decide today to invest in early Head Start, that the two main providers, Albina and Mount Hood, can use that investment in a timely manner?
They can definitely do at least one classroom in a timely manner. I don't know how many more additionally they would be able to do.
So it's possible that we could choose to invest in them and they couldn't really use the money this school year?
I mean, based on how I have always received information and communication with them, that service has as many children on their wait lists as they have children enrolled. So the question is finding the space and equipping the space and getting it open by January. I personally, based on what their responses to me about a single classroom each, I really don't feel like it would be that hard for them to find two more each and each open 3 by January.
Okay.
Meg?
Yeah.
What,
go ahead.
oh, I'm sorry.
No, go ahead.
Can you explain at a high level what the experience a infant or toddler would have between a center-based early Head Start versus a Spark daycare provider?
I can sure try. And I think another thing I would want us to consider is not just the experience of the child, but also the experience of the family and the family's, what drives families' choices for where they want their children to have care. So in a typical center-based early Head Start setting, you have 8 other infants and toddlers. You have a curriculum that is part of how early Head Start standards request and require that you operate. You have staffing that would have a lead teacher as well as probably 2 other adults in the room who are trained to work in that environment. You have a series of health and safety standards that go into much greater detail and some might say bureaucracy than what you might find in a Spark childcare setting in our community or in a family childcare in our community. So there are levels there, as a Head Start provider might say to you in this room, there are over 1,000 performance standards that the center-based early Head Start and center-based Head Start providers have to comply with, and they get federally visited. They get visited by federal Head Start officials on a regular basis to assure compliance with those. The state's Spark quality program is not as stringent. They don't have that type of resource invested in it. There are licensing requirements, which is separate. There are portfolios of sort of quality pieces the providers are being asked to submit and then are being reviewed by a university team that's sort of looking at what the providers submit in their portfolios compared to what would be constituting evidence of quality. They will visit them if they need to. But I think you would see different potentially materials in the classroom, different levels of training of the individuals delivering the service, and potentially different sizes of groups. A family child care provider might have only 4 or 5 children and 1 other adult. A center-based early Head Start will have 8 children typically, and like I said, 2 or 3 adults. Another thing, like I said, when I first started was to think about what the family wants. Some families may not want their child in what looks like a child care center. They may prefer to have their child taken care of by somebody in their greater cultural network in the home who is more like an aunt or a grandma or a community elder and who has garnered the respect of that community as well as been participating in these child care standards that the state is funding folks to be involved in. And that might be more comfortable for them for a number of reasons than enrolling in a center, like an early Head Start center. So I guess if I were to sort of put them together, I think there's a kind of continuum of both what parents want and where they look for it, and then what those programs are funded to achieve based on the level of regulation and or the funding requirements that come with how they operate. Does that help answer the question, Mitch, or are there things I'm not getting to?
That was helpful, thank you.
Okay, sure.
But just following up on that a little bit, with ERDC, that it, just the employment-related means that this is to support parents. It's that kind of child care. Whereas, am I right that with early Head Start, a parent doesn't necessarily use this because they're working?
No, that's actually
that-
not, no,
that
that's
is-
actually
I'm-
not
okay,
true. Yeah, no,
okay.
they have to be either working a certain number of hours, and I don't know offhand what that threshold is, but it's definitely more than part-time.
Okay.
Or participating in the state's jobs program, which is sort of like a rehabilitative supportive program for
Okay.
folks seeking employment, or in school, a certain number of credit hours. So no, you cannot be eligible for center-based full-day early Head Start if you aren't involved in
Okay.
either employment or school at a
All right.
pretty fair hour commitment.
Okay,
Yeah.
thank you.
You're welcome. Any more questions on options A or B before I get to C?
Going to see.
C is a little easier. C is kind of a mix of them both. So you could decide to invest that $1.6 million into a balance of option A to support increasing the affordability benefits that CCI offers in trying to prevent the cuts to the existing focused childcare networks and toward supporting a new Somali network. And you could invest in some center-based early Head Start services. Again, I'd just remind you that option A benefits infants, toddlers, preschoolers, and school-age children because those affordability benefits are for families with any child who is infant through age 12, which is our state's definition of who would qualify for child care subsidies. And then the early Head Start, option B, is just infants and toddlers. So with option C, you could do something like invest up to $780,000 to expand the CCI affordability benefits, $320,000 toward the focused child care networks. So those are sort of, versions of option A. And then up to $500,000 for 2 additional center-based early Head Start classrooms, one with each of the 2 main providers. So questions on, and those figures all come from kind of what the annual costs of those services are. Any questions on option C or just additional questions in general on your options?
So when you talk about the focus networks, is that like culturally specific networks?
Yes, there's a Latino one, 2 Russian, and 1 African American. So there are 12 to 15 childcare providers who commit to 2 years of working with a network coach to submit their portfolio and do all of the things they need to do to get that kind of evidence, so to speak, in line to be able to submit those portfolios. And the other big piece of what they're doing is navigating the training. The coach is helping them navigate sort of the training offerings. What do you really need? What have you already had? What's going to be most relevant for your particular population or the work that you're doing? So those are the big pieces. And network providers provide monthly gatherings for the providers that are involved in that. So the providers end up creating sort of collegial, peer communities that are supporting each other in their professional development path and kind of learning from each other about what's working and what's not working with the improvements that they're making. They also get small financial support to buy materials and supplies and make changes to the environment within their home or outside, depending on what their existing environment looked like. So it's a pretty, I think, creative and robust way to support small businesses while you're also benefiting the care provided to children in our community and for culturally specific communities. Right now, 3 culturally specific communities, 4 networks, and the possibility of adding a 5th.
Okay, any further questions of Meg? Okay, why don't we see if anybody wishes to testify? This is your opportunity to help guide the allocation committee on how to make this decision here. Anybody wish to testify? Okay, I don't see anybody raising their hand, so I guess it's up to us. Okay, so this is the part of the meeting where the committee will deliberate and make a decision.
Oh, I think staff's provided us with just really a lot of helpful information on this, and it is complicated sometimes to sort through what all of these things mean and how to navigate it. I, think about how families have to navigate so much of this information. I stand in support of investing in both options, A and B, which would include then being able to support ERDC, support networks, and then also to support 2 classrooms for early Head Start, one in each of the existing centers or entities that provide that.
So is that option C?
That's option C.
Okay. Good. Rich?
Good, great presentation, and it's, 2 worthy concepts. I'm in favor of option A. As you said, in 2015, we made a substantial additional commitment to early childhood. Option A gives us a little broader reach. It gives us kids 1 through 12 instead of, I guess, 1 through 6, or wherever early childhood drops off. It's about a 2-to-1 bang for the buck in terms of the number of kids we serve. So our dollars are touching more kids and certainly more families in option A. And I love keeping families working that want to keep working. It keeps those families from falling into this bucket that the safety net is trying to take care of that is already overtaxed. And so every dollar we spend keeping families out of that pool is benefiting all the people that are already in that pool. So I guess for those reasons and a few others that I won't go into, I'd like to see us spend all the money in option A for that broader reach, get more kids, broader age, and hit more families.
Okay. Well, I think I'm going to support option C. I think both the ERDC and the focus networks, as well as early Head Start classrooms, are just crucial investments we need to be making. I guess I just wanted to ask you one thing. You mentioned, I think, in your remarks about how supporting the early Head Start sort of carries along a certain expectation, I guess, that those will be funded over time. You just meant, just like any other program that we fund, that there's an expectation that we're always going to be there.
Yes, that was all I meant.
Yeah.
Yep.
So I think with all due respect to Director Hornicker's remarks, I think I'm going to go with option C and would entertain a motion to that effect.
I would move that the Children's Levy allocate dollars to the options, both A and B, that staff have outlined for us.
To A, B, or to C?
I said to A and B,
Okay.
which is the same as option C.
Okay.
I think, is that right?
Well, option B is all of it to early Head Start. Option A is all.
Oh, no, you're right, you're absolutely right. So option C,
Okay.
because the dollar amounts are different. You're right,
Yeah.
yes. Okay, thank you.
You're welcome. Thank you for clarifying.
I'll second that. Any further discussion? Okay, all in favor, say aye.
Aye.
Opposed?
Nay.
Right. Okay, so our investment in employment-related daycare and early Head Start classes, as well as the focus networks, passes on a 2-to-1 vote. So congratulations to the people that we're making these additional investments in. And we're thankful that we're in the enviable position of being able to make such important additional investments in very worthy programs that are helping so many Portland families. So now we'll move on to our next agenda item, which is a vote on the system partner grant recommendations to improve systems that affect children and the organizations they serve.
Yes.
Back to Meg.
Yep.
Okay.
All right, I'll walk you through this one too. Also, a lot of background to help explain to everyone who's here kind of what we're talking about and what the decision is to be made. So also in spring 2015, at the time that you were at that point allocating some additional revenues that were, again, actual revenues coming in higher than had been projected, you set aside $200,000 over the life of this levy toward system partner efforts. You have up to this point invested 125 of that 200,000. 100,000 of it went to a 2.5-year partnership with other private funders to develop more culturally and linguistically diverse master trainers to provide training of trainers to childcare providers who are primarily serving communities of color, English language learners, and rural areas, and to increase the cultural responsiveness of the training curricula as well for those trainers to better support the communities they serve. 25,000 of that original 200,000 was a one-year, one-time funding to a partnership with other private funders to support a cohort of nonprofits, including some PCL grantees, and a funder cohort, including some PCL staff, toward participating in the Center for Equity and Inclusion's multi-year process for looking at policies and practices that increase equity and inclusion at the program, organizational, and systems level. So you have a balance of $75,000 to spend over the next 2 years. And the recommendation I'm about to describe to you fits well with the prior two investments that you've made with that set-aside system funding. So the recommendation I want to describe to you is the development of a training certificate for community education workers. So the community education worker model grew out of a local community planning effort that began in 2012-2013 through leadership from Social Venture Partners Portland locally and All Hands Raised. It was begun to address racial disparities in early learning service access and outcomes associated with kindergarten readiness. And it was modeled after the community health worker model, which is an internationally recognized approach to promoting health education. Community members in communities that are traditionally underserved and marginalized develop their own capacity to support the health outcomes within their own communities and promote system change to address their own needs. The CEW project was launched in 2014 with funding from the state through Early Learning Multnomah and Social Venture Partners Portland. It's a collaboration between some local nonprofit agencies, some of whom are PCL grantees, Latino Network, NEA, Urban League, IRCO, and the Multnomah County Health Department Community Capacitation Center, which is a local leader in training community health workers. This past year, there were 7 CEWs, many of whom are part-time employees in those agencies, who identify as people of color or as immigrants and refugees, serving the following of their own communities: Latino and Spanish-speaking community, Native American community, African American community, Somali and Zomi, and other cultural groups from Myanmar. As a group, those 7 CEWs provided 173 families and 269 children with home visits, parent-child groups, developmental screenings, family advocacy in various public systems, and resource referral and connection. They specialize in helping their families navigate their local public school as they enter kindergarten, which is a substantial and important piece of their work because they're helping mitigate institutional challenges that families have experienced who have traditionally or historically been marginalized in these public systems. Families served by the CEWs all identify as families of color who experience poverty, and over 45% of the families served spoke a language other than English, primarily in the home. Evaluation of the project showed positive outcomes for children and families in outcomes associated with school readiness. Some of these types of outcomes included parents' confidence to help their children be ready for school, their engagement with school and healthcare systems, and parents' report of their own personal empowerment, advocacy, and their social supports to support their children. The 7 current CEWs have each completed 90 hours of community health worker training, coordinated by the Community Capacitation Center at the Multnomah County Health Department, and they earned a CHW certificate, which is a recognized certification through the Oregon Health Authority. They also completed 100 hours of training focused on a variety of topics in early childhood. A couple of examples include the social determinants of health, developmental screening, community organizing, and home visiting skills. Unfortunately, there is no certificate or way to recognize their accomplishment of those 100 additional hours of training. It isn't currently part of the Community Health Worker Certification Program overseen by the Oregon Health Authority, and it isn't part of, for example, the Oregon Registry pathways for professional recognition in childcare and education. So it's a bit of a system miss here for the folks who completed all of that training. So this recommendation would look at funding the planning and development of creating a certificate for individuals who would like to complete that kind of a training and be able to incorporate elements of the CEW model into their existing early childhood services. So home visitors, preschool teachers, childcare providers, and others who are interested in specialized training on reducing racial disparities, elevating family voice, and advancing system change in early learning. The development of the CEW certificate would be a joint effort of all of the partners currently involved in the project. Funding would go toward planning and development of the certificate requirements, standards, and curriculum, building off of what was already developed over the past couple of years with the existing CEW project. The certificate training modules would be piloted in the second year of the project and would be open to PCL grantee staff who are interested in using elements of this model in their practice. The pilot certificate would be a 60-hour training. So funding would be provided to the Latino Network as the lead partner with subcontracts to the existing CEW partner agencies, IRCO, NEA, Urban League, and the Community Capacitation Center of Multnomah County Health Department. And I just want to sort of reiterate that the model grew out of communities of color in our community, looking at disparities in kindergarten readiness for children of color entering our public school system. And it's also a response to what our current early learning system offers and doesn't offer for immigrants and refugee families and children and communities of color. So I think one of the things that sort of speaks the most to possibility here is as the levy moves forward with its next few years of planning and anticipation of what a future 5-year levy to look like, investment in this project could provide a lot of important lessons and learnings that could inform how we do early childhood investments in the future. In addition, it could create a really meaningful professional development pathway that's low cost and free, and reduces the barriers that many folks face when trying to complete professional development and meet certain types of requirements that things like college credit and the costs of college can preclude them from, especially when they're in jobs like the jobs they have now, where the sort of expense out of that kind of training and development may not be recouped in the hourly wage that you're making for the work that you're doing. Are there questions that you have about this? There are also a couple of folks involved directly in this work who are here if you want to ask them questions.
That would be great to hear from those folks. One question first. What would be the burden on Levy staff, the role of Levy staff with this? Even, I mean, handing it off, or Latino Network being the lead partner, but then staff needing to follow up or review for accountability purposes. So
Sure.
give
I
us an
don't know
idea
that I
of
see it as being any different than any other grant agreement or contract that we would have with a grantee. Certainly, it's a lot less money over 2 years than we typically invest, so you know, there's sort of a limit to what it can purchase. The majority of the first year of the project would be around the planning meetings to identify exactly which pieces of the 100 hours would become the 60-hour training component. and really outlining what the training plan would be. And the second year would be clarifying each curriculum module and then offering a pilot version of the training, and then a small piece for evaluation and documenting kind of what their recommendations are to make that 60-hour training curriculum be an ongoing available piece within our professional development system locally. So it could be a looking to how to incorporate it into the registry, for example, and other possibilities. So I don't see it being tremendously burdensome on staff to monitor.
Okay.
I mean, there would be reports the same way that we do reports with other projects. It may not be exactly the same as how we do with our service provision grants, because we're talking about numbers of people who participated, for a certain period of time and got certain kinds of outcomes. It might look a little bit different than that, but there'll still be sort of a progress reporting, and I suspect, and you could ask the folks who are here, that staff would be able to attend planning meetings or participate in the piloting too, if we wanted. Most grantees are pretty open to us when we want to participate or attend, and typically invite us for certain types of things. So I don't see it as being differently burdensome than any other grant that we have.
Okay, thank you.
Yeah.
When you talk about a 60-hour training and a certificate, does that mean it would be offered through a community college or not?
Not necessarily, but does anybody who's here on behalf of the project want to speak to it?
Welcome.
Thank you.
If you could just give us your name, appreciate it.
Good afternoon. My name is Sadie Feibel. I'm here with Latino Network. So the training would be primarily delivered by the trainers at the Community Capacitation Center, along with leadership staff and experienced community education workers in the nonprofits delivering the service currently. So it is by design a really different model to make it more accessible and remove some of those barriers that folks experience in the more formal sector.
And the Community Capacitation Center, that's at Multnomah County, is that right?
Correct.
At the health department.
Health Department. Great. Any other questions? Okay, thank you. Thank you. Any other questions of Meg, or? Okay, do we have anybody wishes to testify on this? Okay, I don't see anybody, so, oh,
Can I just ask a quick question? Would it be possible to open up recruitment through other PCL grantees who serve low-income families to recruit families to go through this training?
yeah. Maybe, yeah, come up.
Introduce yourself.
We need the microphone. You have the microphone.
question, Megan. Thanks. Okay.
Hi, my name is Erica Bridgman-Bugnoli. I work at the Community Capacitation Center, which is part of the Multnomah County Health Department. And I coordinate the Community Education Worker Program for that department. Typically, when we have a training cohort, we usually limit participation to about 25 participants. It's kind of a good size to be able to do it. And so initially in year 2, we would be piloting it with potentially 25 participants. But I do think it could be opened up. It would be available for the community. We'd probably initially pilot it in English. I would hope to be able to make it bilingual or offer it in Spanish down the line. But in the initial round, we would be doing it in English in the first round. And so we could open it up, but we would have that capacity limitation of only having 25 participants in the first initial training.
So you're willing to open it up, but subject to the limitation of how many individuals you can accommodate at one time?
Yes.
Okay, thank you.
Thanks, Erica.
Okay, well, that's time for us to make a decision. Is this, and how much money?
75,
$75,000.
up to 75,000.
Up to 75,
Like, no,
okay.
As with typical grant negotiations, we just would make sure that all makes sense and what the budget
Okay.
is and what they want to accomplish.
I'd make a motion I support the program and the allotment of up to $75,000.
Okay, move. Is there a second?
I second it.
Okay, moved and seconded. Any further discussion? All in favor, say aye. Aye. Okay, no? Okay, so it's approved. So thank you, everyone. And our last agenda item today surrounds planning for community engagement. as we look forward to levy renewal in 2018. And I guess I just want to make some remarks at the outset, because I'm getting a little confused about the discussion around this. So this is about if the levy gets renewed, how to plan to make additional investments. It's not about it's not about what the levy will look like when it appears on the ballot, or what any features, okay?
It has nothing to do with the ballot. That's your department.
Okay,
I stay clear of that.
okay.
No, this is partly the reason that we are raising this right now. First of all, there's no, we're not asking anybody to make any decisions, so I'll just make that clear off the bat. We're really just here to begin the discussion. One of the big pieces of feedback that came out of the last funding process, so a funding process usually includes all of the input and decisions that happen before you actually release your funding application, and then the funding decisions that come out of that funding process, right? So in looking back on all the feedback that we gathered last time throughout that whole process, one of the pieces of feedback was everybody wanted more time for all parts of the process. And so part of our effort here is to begin early enough in thinking that through and getting you all to help shape, as well as other people in the community to begin to help shape what that would look like. And in order to leave enough time to do that, if again, this is assuming that the levy will continue to operate on a similar schedule where there is some kind of competitive funding round, and that happens sometime in relative soonness to when the levy is renewed. Now, that could change. People could decide not to do that. But if they do decide to do that, our idea would be we'd want to be thinking how we're prepared to do that if that's the process that people choose to use. So part of the beginning, or I would say the beginning part of that is thinking about the planning and community engagement piece that you might want to do ahead of time, because that takes time. It takes time to figure out what you want to do, and then to execute it, and then to take whatever input you get and then use that to fashion something that either looks the same or different than what you did in the past. So that process is labor intensive and time consuming. So that's kind of why now. But no, you're right. It has nothing whatsoever to do with the levy renewal itself. That's the political side. So we're strictly on the planning and execution side. In order to even begin the discussion, I felt like I had at least remind you all of what we did last time, so that because years go by and we all forget what happened last time, and not all members of the committee, I didn't necessarily anticipate that everybody would not be here, but not everybody was not necessarily going through the process last time. So I'm going to spend a few minutes refreshing all of our collective memory on what we did last time. So last time, staff conducted the entire process because revenues were down in the last levy period due to the recession, and there was no additional funding to hire any help to conduct a community engagement or planning process. We focused our input pretty significantly on what the funding and service priorities should be when the levy was renewed, using the ballot language that was going to be used at that point. So we knew what the ballot language was at that point when we started the planning process. We also gathered input on the overall goals for the levy. So the levy has overall goals for the entire investments we make, as well as program area goals and strategies that go with that. So we took input on needs and priorities, and then we fashioned goals and strategies, and then we took input on the goals and strategies, and those were massaged further with that input, and then that was kind of adopted, and then that was what was used to create the request for investment, which is the funding application. Okay, so that was sort of how we got to that point, was to take that sort of input ahead of time. The methods that we used, we tried to model it as much as we could on what Oakland does. Oakland has a children's levy, and it's about the similar size to our levy. And admittedly, they hire outside people to help them do this process. They don't do it as a staff run, but we tried to emulate as much as we could for the level of capacity we had by getting as much input from different quarters and then looking at local data on children's outcomes and considering best practice in designing strategies. So in order to gather input, we used a variety of methods. We used a survey that was translated into 4 languages other than English, mostly multiple choice and short answers, so brief kind of input. We had about 500 respondents to that survey, and that was done in hard copy and online. You could do it either way. We had a lot of stakeholder and community group meetings, and this has mostly consisted of staff going out to all different groups in this community that one way or another work toward improving lives for children and families and have input on the kinds of services that would be funded by the levy or the way that we do our business, what kinds of things are done. We talked to about 40 groups and about 300 people through that process. And then we had 3 sort of big public meetings, which is mostly an avenue for providers to be able to come in and give their input, and that was about 100 people total. So like I said, we compiled a local data report that looked at the community-wide outcomes for children, so you all saw that as well. And also looked at best practices in the individual program and funding areas, things like what are the best practices around home visiting, since people want home visiting services. So that you all looked at all of those things and what came back before fashioning the funding application and the decisions in the last round. So some themes that came out of the last process is, again, just to refresh you at the very high level. This was across all the program areas. There was a lot of specific information that was gotten, and we put that into an 80-page report, which I will not review here, but about program area specific things. So at the highest level across all of the Levy program areas, there's a lot of input to focus on intensive and longer duration relationship-based services that focus on family and child goals, so very family and child-centered services. To focus on populations that are most at risk for negative outcomes, especially children of color who experience disparities in those outcomes as compared to white children. To focus on high poverty areas, geographic areas of the city as well, in this case, Outer East and North Portland primarily. To fund culturally specific and culturally responsive services that really focus on culture as a part of the design of the service. And last, to increase professional development for grantees. And that's something that you all have funded with some of that additional money. We've provided a lot of more opportunities for professional development and funded system-wide professional development in some cases. So that's how we got to those kinds of priorities, is from those themes. After the whole process was complete, we took feedback, as I last said, from all different folks who participated, the applicants, the reviewers, you all, and staff. And got sort of some high-level feedback on those, one of which was to extend the timeline for all phases of the process because it wasn't enough, people didn't feel there's enough time for people to participate adequately or enough time to consider decisions, enough time period. It's just difficult to be rushed. Folks thought that the giving of public testimony in the context of making funding decisions was not liked by either the committee or the people participating particularly because it is so much information in a short space of time. It's difficult to digest and doesn't really allow for much dialogue. So that was something that we might want to think about addressing. And then I would say there was some level of dissatisfaction with the decision-making process, both from the applicant side and from the committee side, due to a lot of the limitations that are imposed because of public meetings law. So those things make it difficult to have lengthy decision processes in which people can talk in a variety of contexts. I don't know how much can be fixed about those things given public meeting law, but that was definitely something that people gave feedback on. So what we wanted to do today was really just kind of open a discussion and get some people's thoughts about a few things in thinking about beginning this process. One of which is, do we want to think about hiring someone to help us design and execute a community engagement and planning process rather than just having it be staff-led? And then what sorts of topics do you want to go out and engage the community and plan about? What do you want to create? What's your field of inquiry that you want to open up for that process? And those are the things that probably have to be thought about first before we can start moving forward on that. I think we see as staff some advantages to having outside help with this for a few reasons. One, it obviously increases our capacity to do more and broader engagement because we're limited time and have other things we have to be doing with our time. Besides that, you can use more intensive methods of engagement like focus groups or interviews or things we did not have time to do last time if you've got additional capacity. People from the outside can have different expertise than we have, and we're limited, all of us, in what we know how to do and do well. We would also have the capacity potentially to hire people who are closer to diverse communities to gather and filter that input and facilitate those discussions. There's always a limitation, I think, in staff asking face-to-face for input when people don't want to criticize you to your face. So there is a chance maybe to create some more anonymity for people and more ability to get honest feedback on how people want to proceed without having to directly say it to us. So I think that gives perhaps different kind of input than we can gather ourselves, particularly when talking to groups of people face-to-face. I think that's it. I think that's all I can think of for advantages. We're not as constrained by finances this time, so we would probably have the financial ability to afford to pay someone to help us do that. I think if we were going to do that, though, we have to think about what do we want, and that includes from you all thinking about what kind of topics do you want to go out and gather input on. They can include, obviously, the priorities and for investment and funding, and the needs and the gaps in the community, kind of many of the questions we've asked in the past. It could also include levy governance and structure moving forward. We've been in existence, almost 15 years, so it may be time to consider it and look at that. Our funding processes, everybody has feedback about the funding processes, what they like and what they don't like about them. We just piloted a 2-step process, and we'll have time to give some feedback and thought to that. So thinking about what kind of input might people want to gather about the funding process itself, what works, what doesn't work, what people would like to have. So those are some different thoughts, and I guess I kind of wanted just to open it up to you all to think about what are your interests, what direction are you wanting to head, so that we can begin shaping something and begin moving through a feedback process to figure out how we want to go forward.
Questions or
Questions?
questions or advice for Lisa?
There've got to be
Did
opinions out
Oakland,
there.
did Oakland use an outside firm to help guide its process?
Yeah, they have an RFP, and they hire a lead person, lead consultant, who then typically has subcontracts with a variety of different types of folks who might either be out there facilitating the gathering of input with particular groups. They may have expertise in particular communities or connections in communities, or they may have expertise in, they do strategic planning for specific initiatives. They do their business a little bit differently. So they have specific initiatives that they do over a 3-year period. And they also, these consultants help them plan for that, what those initiatives will look like. They also do more work in figuring out exactly how these initiatives are going to fit or braid into existing community investments and efforts, so that consultant is charged with doing some of that work too. So theirs is a little bit broader potentially, or it looks at some different things because they have some different mandates and how they do their work. You look like you want to ask a question. I'm sorry. I'll stop. No?
Actually, I was curious to know whether, you note the process used in 2013 and 2014. What about prior to that with the children's levy?
The one
what
before
was
that,
done?
there was a little bit of consultation assistance hired to facilitate public meetings. It was hired for that purpose. It was not involved, the people were not involved in the design of the process, or the only execution they were involved in was the conduction. It was pretty small scale. All we did was public meetings, and they were primarily attended by providers.
Okay.
So there wasn't any effort to reach parents or youth or other groups that are much more difficult to reach, who can't come to a meeting during the workday, who can't come to wherever you're hosting your meeting necessarily, or might have difficulty in doing that. So it was pretty limited.
Okay, all right. I think all the points you raise are, are valid. The whole point being that we want to be serving the public, and how best can we do that? How can we reach the communities who need services, and to be better informed on how we're doing at that? And I think that hiring expertise in that is a real opportunity to get that information in a way that we possibly haven't been getting it. But it sounds like what I guess isn't entirely clear to me is whether that, say, consultant would actually design the whole thing, or how much either we as a committee or the staff would say, this is what we need.
Well, I think the idea would be to try to develop amongst some thoughts amongst the committee members about what kinds of things would they want to see. What are they interested in investigating, and how are they interested in doing it? And so we can help drive that process, and as well as get feedback from a consultant about what would be desirable or good to do. So I think it's going to be a back and forth iterative process, and I think no matter what we did or whatever we thought about doing, it'd be good to go out and get input on what we're thinking of doing before you all make a decision to do anything in particular. So I'm sort of imagining input from various quarters on how to move forward, but I thought it would be better to understand what your thoughts or feelings are about doing this kind of process, or what are priorities for you, or what do you care about the most in doing this kind of planning and community engagement, so that we can begin to braid that into what it would look like. Or before we bring, I mean, obviously we're missing 2 people today, so I'm missing input from those folks. Deborah did give a little bit of input that she was interested in a robust community engagement process going forward. But obviously we need to bring the whole committee into the discussion, but I thought it would be useful to hear what people think about it so far. Or what your priorities are for investigating. What do you most want to hear input about?
Well, if we were to say, yeah, go ahead and do this today, or maybe at our next meeting, what would you do? What would be your steps, and what kind of a timeline do you envision this process would occur over?
Well, if people want to, try to get a consultant to help, then that takes time, because you have to go through a city purchasing process to do that. So that's partly why we're raising it now, because that will take time. It always takes more time than you want to do that, and then to shape what that scope of work would look like. So we're kind of in the investigation process on the staff side, and I think before the next meeting can bring more intelligence to you all, both from groups who have hired these types of consultants. What sorts of folks have they hired? What kind of people, what kind of benefit did they see from doing it? What kind of folks might be useful to consult, or I should say to outreach to, and bringing on board to help with a kind of project like that. So we're in the process of collecting that information. It's not at a point where I can feed it back to you yet, but hopefully within a couple of weeks we'll have some more information. I think it would be helpful, and I think we can do some work behind the scenes before the next meeting to begin shaping this with all of you giving written input on things, but I thought it would be helpful. And also, if you want to ask, I know there's not a lot of folks here today, but if anybody who's here has thoughts too, I think that would be helpful to hear. It's just sort of beginning to put the bones. Timeline, I think it would again depend. If you want to hire somebody, we got to start sooner than later. If you don't want to hire anybody, I don't know, that really changes it actually, because then it's just more work that we need to do, and then we need to plan for that as well. So I still think we'd have to shape what are we asking for input and engagement about. That's going to have to be shaped. So, I mean, over the next 6 months, I think we have to be making decisions to understand how we want to move forward.
I mentioned to Meg when we talked about this, it would really help me if I could understand whether we felt there were some misses or big misses in the last process we did in engaging the community. And if there were big misses, why were they there? How did they come about? And what would we hope to change the next time around before I'm, in a situation where I can say, well, a consultant could help with that or not help with that. For instance, I mean, if we're talking, it seems like we're just talking community engagement in terms of getting their feedback on what we're doing. So we could say our plan is to continue doing what we're doing unless the community engagement says we're on the wrong track. Or we could go engage the community and ask them to tell us what they think we should change, and then decide amongst ourselves what things we liked and didn't like, and then go back out to them. I mean, it feels just like it's just too broad at this point for me. I don't understand the problem we're trying to fix. I get the community engagement. That's easy, but did we not do it very well last time? I know we didn't hire an outside consultant, and I know cash was strapped, but what does that mean? So I just like a little more understanding on, and as Julie said, and then rotating it back. Every 4 years, do we go into a deep dive with the community about, the levy and where it should be heading or not?
And I think that's where we're coming from, that it's probably worth doing a deep dive at least once every 5-year period to make sure that things haven't changed in terms of what community conditions are. So, I mean, I think there's a role for staff around some of the data and that kind of stuff that is, we can compile for people to sort of set the stage. I think that the limitations of what we did last time, and again, I'm not sure, we got some feedback from people, but again, this is the same limitation. Are people going to give feedback directly to the staff who designed the process by which the feedback was gotten? So you limit to some extent. You don't know what you're missing if people aren't willing to speak to you one way or the other. So I'm not sure I could give you a list of what were the big misses, other than some of the feedback around the process in general was more time for public input, a more robust time period and process. So we did a written sort of instrument, a survey, we did stakeholder meetings, and we did sort of come on, come all kind of meetings that were mostly providers. We didn't go out and speak to groups of parents. There were no focus groups done. There were no interviews done. There was no engagement of folks who are much closer to the ground and involved in much more grassroots kinds of efforts in different communities, because there was just no time or capacity to do it. The whole public input process probably happened over about 4 months. Time in terms of actively soliciting this type of input, and then the rest of the time was spent compiling it and creating something out of it and reacting and deciding and then moving forward. So it's not so much that I'm not sure I could name if we missed anything. I'm not sure I would know if we missed things, because there's a limit to what we could do. I'm not sure in other words, I don't know if I can forecast that something different will be gained unless we try it. My hope would be to gain a broader perspective. And also, I think if you want to go out for input around how the levy's structured, does its funding, more process-related, governance and process questions, which were not asked before, that would be something additional and different. We didn't ask for feedback on those things particularly last time. Or we didn't open up particularly to those kinds of issues. Does that help at all or no? Doesn't look like much.
Well, no, if I summarize what you just said is, because we did it, we don't know if it would be better if somebody else did it.
To some extent, yes.
So if that's the question, then, I'd want to say, okay, what do we know about the way we did it? Have we got anecdotal evidence that we only got superficial responses because of who was asking the questions? Do we have, have people said to us, have we done a survey, could we do a blind survey? All that kind of stuff. And if the answer is, yeah, we felt like having staff run it hampered the honest feedback, it seems like that honest feedback would only be skewed by people who are currently funded or would want to seek funds from the levy. They're the only ones who would seem to have a political interest in not offending the questioners. I don't know why community organizers or people on the front lines who aren't involved with levy dollars or levy funding would have any inhibition of telling staff what they thought. So
I think the point is more we don't reach very many people like that.
Yeah.
We just don't.
So would it make sense, and again, I'm out of my depth here, but is this something that we could ask a small group of people who consult on issues like that to write proposals about what they would do and how much it would cost, so that instead of, as you say, not knowing what we don't know what we missed, have people who do this for a living and have provided services to other organizations come in and say, well, if I was in your shoes, this is what I would do. I would hire us and we would do X, Y, and Z, and the feedback you'd get would look like this, and you would be able to act on it.
Yeah, I like that idea.
Yeah, I don't know that we can ask people to spend the time to come and talk to us. They might be willing, I don't know. I don't know if folks can afford to invest time to tell you why you should hire them coming to a meeting in person, as opposed to, the typical thing is people submit a proposal to you about what, within parameters, rather than orally come in and try to sell their services to you.
Could be all right.
So,
I wasn't thinking that they had to
okay.
give testimony or.
Okay, I just want to be clear how much you'd be asking for. Okay, I have to think about what exactly you mean by that. So you're thinking of sort of almost something beforehand, like let someone else make up the process? Don't put any parameters out and say, you tell us what a good community engagement process should be.
Well, since I don't hear you recommending one.
Well, I'm not,
And I'm-
because
I
I'm
don't-
not,
And I'm not qualified to articulate what it should be. I don't know if you guys feel different. We're going to need somebody to put a at least a straw man out there that we can start looking at and saying, I like this, I don't like this, what about more here, less here, kind of a thing.
well, I mean, it's not, I wouldn't say it's not that staff hasn't thought about what kinds of communication we could do. I think it would be a different process to go through, to have more of a dialogue about how that would roll out, depending on what I also was interested in before we put our own footprint on this or framed it for you. Did you have input at the front end to assist in that framing of it? Does that make sense? So yes, we could write you up something, and I think we're going to be speaking to some people who will hopefully help us frame that. But I was, even before I got that far, I was interested in hearing, were there things that you all think would be desirable to include that we didn't include last time, knowing now what we did last time, right? And you're saying you don't really have any opinion about it, maybe, I don't know, one way or the other. Or
Well,
you would want someone to
I
tell
mean-
you rather than offer.
It seems like there's consensus that we want community engagement on what we're doing and how we're doing it.
But more specifically than that, I was interested in your thoughts.
In terms of how to accumulate the community input?
No,
or
what
in
do you want to
terms-
hear input about?
Oh.
Or do you want to hear input about, I mean, but like I said, in the past, we've asked around.
Well, yeah, I
we've
mean,
asked
I
around
guess,
community-
from my point of view, I thought our processes in the past have been pretty robust. But there's always people that are not happy because the outcome didn't turn out the way they expected it with respect to a particular decision to invest in that organization or not. So that leads to some disgruntlement. And, feeling that, the process wasn't fair because staff were running it. Sort of a lot of things you hear that are just, in my mind, a lot of it's just sour grapes in the final analysis. And I guess any discussion, as I said at the outset, this is not really, the discussion about governance of the children's levy is a discussion that occurs by voters. Voters make the decision about the governance structure of the children's levy in terms of the allocation committee. So, given that, sure, we can ask people about other governance structures, but as I said, the governance structure is determined by the voters.
Up to a point, but not funding process. I mean, the funding process is decided by the committee usually. So it's a question of whether you all are interested in hearing feedback on funding process the way it's been run. I mean, if you're not, that's fine, and to know what the parameters are. That's part of the reason I wanted to ask, is I wanted to find out what are people's priorities? Are they mostly interested in what the community needs and gaps in services are, or priority strategies, or what types of services? Those are the questions we've typically asked. And if people want to keep it to that, that's fine. I just wanted to hear before I begin shaping it, so part of your feedback to us is sometimes been less shape on things and more input at the front end. So we're trying to change our practice and ask before we put shape on it, what are you interested in, so we can
And we're
take
making
your...
it hard for you.
And yes, you're making it difficult. If you don't have any input, that's fine. I'm willing to accept that, but I wanted to make sure to ask, and I am interested in hearing if you have priorities or thoughts about it before we put shape on it, what that would be. I mean, if you don't, that's fine. We can go ahead and put some straw men up there for you next time around, and you can give feedback from there.
Lisa, can I interject really quick? Just to be clear, too, the shape that we have discussed as staff putting on it isn't just what we're talking about in our office because we want to talk about it. I mean, we're talking to other city departments who do this work and have had input processes. We've looked at what Oakland is doing. We're talking to
The county.
Kim Melton on Chair Kafori's staff about sort of what county departments have done. So we're trying to understand what are some of the practices, under what circumstances are public departments or divisions doing process A instead of process B when they're doing community input? Like, what kinds of structures are they using? So I wanted to sort of be more transparent about, to your point, Mitch, about sort of you should be, it might behoove us to talk to folks who do this for a living and find out what they would do if they were in our shoes. Well, we're kind of trying to understand that right now by sort of some informed one-on-one discussions with folks who have either contracted out for these exact types of processes or had other sort of ways in which they've handled them, and try to get our hands around, well, what does it typically look like? What are the types of questions asked depending on what input you're trying to gather? So I don't know if that's helpful, but.
Yeah, I mean, we're in the process of doing that, but like I said, we have this opportunity because we're all together here today. I thought it would at least be worth opening up the questions and asking you all if you had particular thoughts about it. So yes, we will provide you, if you feel like you need more information before you can have any input, I'm happy to give you more information if that's what people want.
Well, it seems like the obvious question is, are we going to ask for input? I mean, we could ask for input about how we run these meetings, but because of public meeting laws and the way this organization is structured, there is no flexibility. We could ask for all the input we wanted, and it could all say, stop having meetings like this and making decisions like this, and we'd say, we can't. It's just the way the structure works. So I would not be in favor of asking the community about that, because there's no, we can't act on their frustration. I'm very much in favor of finding out from the community. I mean, it feels like, we've made a big push east. We've made a big push to find those historically disenfranchised communities, the communities of color who have not gotten both our funding and have not got their fair share of public benefits, and tried to help those communities and target our funding. And to me, I'd like to hear from those communities if they think we're doing better. And I'm interested in figuring out how to do better in that regard. I think we're on the right track. I don't personally feel like we should go back to square one and say, how are we doing business? What does everybody think? If we feel good about the direction we're going, then I would like to hear about how to get better and fine tune that.
Okay, that's helpful.
Or gaps in
Yeah,
services.
which is a
yeah.
different way of saying where are those gaps, and are we filling in those gaps?
I mean, I will always ask about needs and gaps. That will never be off the agenda. It was more, what else in addition to? So that's helpful to hear your perspective on that. Did you? No? I thought you were about to say
No, I
something.
guess, I see that as the allocation committee, we're involved in the funding process. I think that a lot of the questions, or what I'm guessing, a lot of the conversation perhaps one would have if you go out into the community are around the administrative, how that all works, in terms of how our grantees are working with the staff and that back and forth. And because that's a big part of it. I mean, we have a very, in a sense, small role to play, we as the allocation committee. We make some very important decisions, not easy decisions, but on a regular basis, we're not interfacing with the grantees as staff is.
Mm-hmm.
So I see that, I mean, I'm sure so going out to the community, the part that we may want to make sure we have some information on might be a fairly small part of what you would want to know. And I think a lot of what you need to know maybe would be better asked by consultants, someone who's brought in rather than the staff.
Mm-hmm.
Does that make sense?
Yeah. Mhm. Okay, well, that's helpful. That gives us some ways we'll move out from here. And I guess we'll try to put some shape on it a little bit further, bring you some more information from what we've gathered from other sources. And at the next meeting, we'll try to hash it out a bit further.
And I think it's important to know what kind of a expected budget we might be looking at for these types of services.
That's in the process of trying to figure that out. So
Right.
until you start putting more brass tacks, it's difficult to know. I mean, all I know is that, what is it? Oakland, Lisa, was that 100,000 they had for a year-long process? That was main and subs. So
Okay.
they did a year-long process. They have some slightly different deliverables than what we might have, but that's about the only thing I have right now in terms of thinking that through. And so, like I said, we're talking to a number of other people who, most governments do a public engagement type of process before they make large investments. That's pretty typical. So we're out there speaking with different people about different ways they go about doing that, and what price tags they have, and what kinds of methods they use, so that can govern how expensive something is, the more intensive or the broader or the more individual types of feedback that you offer, rather than, say, a survey, which is cheap, relatively speaking, right? So that's why staff could execute it, because it doesn't take as much time to go out and speak with people individually. So that changes the price, obviously. So we'll have some more information, and we'll go from there and try to shape it. We'll maybe get you something on paper before the next meeting, and then you'll have a chance to react, and then we can have a chance to discuss at the next meeting. Is there anyone from the audience that wants to say anything about this? Their thoughts around community engagement or how we should proceed? There's people still here. I would love to hear from folks.
Okay, well, thanks, Lisa. That wraps up today's meeting. I appreciate everybody who's in attendance, and as well as the committee members themselves. And while we don't have another meeting scheduled at this time, we do expect it will be sometime later this fall. And as always, agendas and notices will be posted on the Levy website and sent to our database. So thank you, everybody, and we stand adjourned.